We have another story. This one is about diabetes, specifically a new diabetes drug. This seemed like people were really excited about this. I know very little about this, but we're gonna see if I can say these big names. This is from ABC News. For the first time, the U.S. Food and Drug Administration on Thursday approved a treatment that can delay the onset of type 1 diabetes. Teplizumab, a monoclonal antibody that will be marketed under the brand name of Tzield, was shown in clinical trials to delay onset of insulin dependence, type 1 diabetes, for patients with autoantibody markers of early risk by over 2 years, with hopes for some that it could delay the onset even longer. Tzield was approved to delay the onset of stage 3 type 1 diabetes in adults and children ages 8 and up who currently have stage 2 type 1 diabetes. The medication is thought to slow down the body's attack on its own insulin-producing cells and thus give people more time before they become dependent on pharmaceutical insulin. Tzield is not suitable for people with insulin-dependent type 1 diabetes, so I assume that's people already in stage 3. People who are pre-type 2 diabetics or those with type 2 diabetes. So this has no impact at all on type 2 diabetes. This is specifically for type 1. Okay. All right. Help me understand this. What is a monoclonal antibody? I know I've heard that term in the news. I don't know anything about it.
In layman's terms, basically, it's a drug class that's used in treating a multitude of conditions. They're produced in a very complicated way. So essentially, it's produced with a cell line that's made via cloning, which is from essentially a unique white blood cell.
Okay.
And it has monovalent affinity, meaning it will only bind to one specific part of an antigen or the bad guy. So you create this monoclonal antibody, which has the ability to go out and exert these either anti-inflammatory effects or anti-cancer effects, whatever the antigen brings to the table is essentially sent out to neutralize that, for the lack of a better term.
So it's an antibody. It's a white blood cell that, in effect, like your body would produce it theoretically on its own to fight a thing, but isn't for whatever reason or can't or what have you. Yeah. It's produced in a lab and then used targeted specifically to boost your own immunity, in effect.
Yep. So essentially, it's like they'll look at what the antigen is.
Yeah.
Or they'll look at what the white blood cell is, whatever can, either way, like whatever can help attack the antigen or whatever the theoretical white blood cell looks like. They'll make something similar to that, and whichever one has the most affinity for that given antigen is ultimately how they come up with the treatment. And so they can use like human DNA, they can use animal DNA, they can manipulate viruses.
Mice a lot.
They can use all those sorts of things to come up with these sorts of molecules.
Okay, so this is one of those.
It is.
And it functions by what did it say here? Medication is thought to slow down the body's attack on its own insulin-producing cells.
Yeah.
Thus giving people more time before they become dependent upon pharmaceutical insulin.
Mm-hmm. Yeah, so they found what antibody is or antigen is attacking the pancreas essentially, and is causing type 1 diabetes. And they, build this monoclonal antibody to stop it. The only issue is that it doesn't work for all that long.
Yeah,
that's really the only concern. It's an amazing accomplishment, and I could certainly see that this is a first step into the company themselves and just this line of thinking doing amazing things. But yeah, it is tough. And again, it's easy for me to say I'm not, stage 1 or stage 2, type 1 diabetic,
Right.
So just real quickly, the stages, so they don't really talk about stage 1 here, but stage 1, you've got some autoimmunity present, but you don't really have any symptoms and you don't have any blood sugar control issues. So stage 2 is where you start having some blood sugar
That's when it typically gets spotted.
Yes. But so what they're trying to do is or what they believe they can do, and what they have shown they can do, is arrest it between 2 and 3. Because when you're going into 3, you've got full-blown antibody, obviously, you've got blood sugar dysregulation, and now you've got insulin dysfunction, and you need insulin. So that occurs. So basically, it's stage 2. This is the note I wrote, sort of about writing what it was. The risk, if without the drug, of you going to stage 3 is 75%. Okay. And in a lifetime, it's 100%.
So it's going to happen eventually.
It approaches 100% untreated, but it's 75%, I believe, within like 51 months. Then if you do the medication, here's what they found in the study. So 45% of the 44 who were on the drug, okay, 45% of the 44 were at stage 3 at 51 months. So 45% of the 40, significant number, at 51 months were there. It's usually 75%, historically.
Right.
72% in the study, so the study matched up almost exactly, 72% of the 32 placebo members of the study were at stage 3 at the 51-month follow-up. Okay, so we follow on that. So 45% versus 72% at the 51-month follow-up. So, it's significant.
Was it 26, 27%, something like that?
Yeah.
27% reduction in...
It depends which way you flip it. Yeah, so, I mean, that is, that's definitely significant. But when I believe, what would they say this was $194,000?
Yeah, this is from CNN. The monoclonal antibody to teplizumab, Tzield, is given through intravenous infusion. The therapy will carry a wholesale cost of roughly $194,000 for a full course of treatment. And the drug's manufacturer said in an investor call on Friday, although this is not expected to be the price that consumers would pay. Wholesale cost of almost $200,000.
Yeah. Which makes me realize that pharmacies will never see it. It'll be a kind of a medical benefit sort of thing.
Yeah, so it's going to be happening at hospitals and things like that. Which, I mean, I guess if it's an intravenous infusion, that's probably the way that would be done normally anyway, right?
Yeah, and I do wonder, how insurances will be convinced to pay for this, given the amount of time. I know how serious it is, but if you're, 32 and you're delaying it by a year or two, I just don't know, to living,
because that's what they
hopefully
said.
Your 60s or 70s, that a $200,000 investment in you to push that back for a period of time is something that the Blue Crosses of the world are going to do.
Yeah.
So I don't know. This becomes something for the wealthy. I don't know. And then what are they going to find the benefit in that? So again, I do want to look more into it. There's not a whole lot out there. It's brand new.
Brand new.
There may be some more. There may be some more benefits that we have not seen or that have not been released yet. That's quite possible. But as of now, I look at it more, me personally, that it's an amazing thing in terms of what it's capable of doing, what its future represents. But I can't quite feel like it's amazing in what its actual result is.
Yeah. Because these people eventually are going to still develop. I mean, basically 100% of the people will eventually have type 1 diabetes.
I mean, this was a follow-up at 51 months in the study. 45% of them got it.
Yeah.
But versus a normal 75.
So for those it works, you're looking at more time without having to do injections or deal with some of the other ramifications of type 1 diabetes. But it's still a limited time benefit.
Yeah. And again, you could be watching this video and said, how horrible life is with diabetes. And if I could have bought 18 or 24 months, how could you possibly say that that's not valuable?
Yeah.
And more, I'm looking, you know what I mean? I'm trying to balance the personal and the practical as much as I can.
Well,
that's all I'm doing whenever I'm saying the pricing of this. I think if this was 10 grand even, divided by 12 months, I'd be saying it's a miracle, and I would do it too. And
right.
all those things, and insurances will pay for it. But you're talking about medication that's usually reserved for like life-saving cancer type treatments. And
and you're not talking about whether somebody should or shouldn't do it. You're talking about, will insurance pay for this?
Exactly.
Because that's a
nuts and bolts.
That's a business decision, as weird and cold as it may be to say. That's why that number is relevant.
Yes.
But on the plus side, I guess, if they can do it and they can make that money, maybe they will continue research and come up with a cheaper, better version that works for longer.
Because you would have to hope that either the next version of what they make, or this is a very much a copycat industry, where you're going to have all these drugs end in MAB, these monoclonal antibodies. You're going to have some other MAB drug made by some other biotech company, and they're going to delay it. They're going to, they're going to double these numbers. They're going to guarantee delay for 5 years. And now you're talking, whoa, you know what I mean? Life-changing stuff. And that's what I believe we're going to see. I just don't know when.
Yeah. So this is cutting-edge research. It's exciting from that perspective, but temper the excitement because it's really expensive.
Yeah, let's keep our eyes open for more information on this possibly, and also for where this exact class goes from here.
Very cool. Very cool.